Good evening, everyone. On behalf of Academy of Pain Physiatrists, I warmly welcome all participants to our 17th webinar on AI in pain management. We are delighted to have two eminent experts joining us today, our moderator, Dr. Rakesh Kumar Srivastava, sir, and our speaker, Dr. Avneesh Khare, sir. Before we begin, let me share a few basic instructions for a smooth conduct of the webinar. All participants are requested to keep their microphones muted during the session. Please type your questions in the chat box anytime during the talk. The question answer session will be held after the presentation. Participants may mention whether their question is for the speaker or moderator. Now it's my pleasure to briefly introduce our distinguished guest. Dr. Rakesh Kumar Srivastava sir is a renowned expert in the public health, medical education, and disability and rehabilitation and digital health and AI. He has held several key leadership positions, including Director General of Health Services, Senior Advisor at Wish Foundation, and Chairman of Medical Council of India. Dr. Srivastava has made exceptional contribution to strengthening public health system, digital health policies, and rehabilitation program across India. Our speaker, Dr. Avneesh Khare, sir, is an educator, mentor, and consultant in artificial intelligence in medicine. He currently serves as an advisory board chair of Dr. AI Education and Research Foundation and chief advisor at the Indian College of AI in Medicine. He featured in Forbes and Times Square. Dr. Khare is globally recognized for advancing responsible adaptation of AI in medical practice, education, and healthcare innovation. Now, I would like to hand over the session to our moderator, Dr. Rakesh Kumar Srivastava, sir, for his opening remarks and overview of the topic. After Srivastava sir briefing, the technical session will be continued by our speaker, Dr. Avneesh Khare, sir. Thank you, all of you, once again. Over to you, Dr. Srivastava, sir.
Thank you, Avneesh. I think you have given good enough introduction, mine as well as of the speaker. Just to begin with, I would like to talk to you certain salient thing about the AI in pain management. Basically, AI is here in the system. Both it is there either in form of a software as a medical device or a software in medical device. The solutions which are coming over here are about 5 to 10% locally developed and thereafter locally secured by the developer, and then they are marketed. And about 90%, 80 to 90% are coming from outside and they are being marketed over here. The system in India is not very robust as far as the regulation of AI as a AI product or AI powered product as a software is concerned for pain management. It is in process of evolution. Drug Controller General of India has made it compulsory for all such product to be registered and pass through the rigorous regulation whatever they have developed. The DPDP is for the personal data protection, and it is also it's a good initiative from Government of India. The program which is going on in India as far as application of AI in the healthcare is concerned is also moving fast during last 4 5 years, starting from the National Digital Health Mission to ABDM, and now we have got unified AVA number, to registry of provider, and the provider as well as the facilities, the DigiDoctor, EHR, all these things are there in within the system. But still, there is a long way ahead, and one has to play very cautiously in this sector because apprehensions are many, and I think abuses as well as confusions are there among the doctors for application of the AI. With these opening words, I will hand over it to the speaker, Dr. Avneesh, so that he can take you forward to how best we, as the PMR expert physiatrist, can utilize it in the pain management. So handing over to Dr. Avneesh, please go ahead.
Thank you, sir, for giving such nice introduction and for such nice words, like setting the right tone for the webinar. So I will just try to carry this forward, this message, and I will show a few examples, and also I will try to end on the ethics front so that people are having some more clarity on uh, they should use AI, but they should use it responsibly. So let me share my screen. So I hope my screen is visible.
Yes, visible, sir.
Yeah. Okay. So once again, I thank the organization for inviting me, for giving this webinar, and for Dr. Minaj for reaching out and asking me if I can give a webinar on AI in pain management. To be very honest, this is one of my first webinars on this topic, especially in pain management, although I have been learning and speaking a lot for the last 5-6 years on different topics, including emergency medicine, critical care. But pain management was one area where even I have a degree in pain, like PDCC, I've done 1 year from BHU. But somehow, because of this webinar, both the things have become have intersected, AI and pain management. So let me see if I can help you understand about this subject. So Minaj introduced me very nicely. So this is me during the last 2-3 years, my journey. So it all started with G20. If you must be knowing, it was in AIMS Rishikesh, and Dr. Sanjeev must be knowing. He has done his studies from there. So they had a panel on digital health and future of healthcare, and this is where I got this inspiration as well to keep learning about this subject and to start teaching my fellow professionals, because this is definitely the future, although the era is evolving and still regulations are not so clear, but it is not going to remain like this for the next 10-20 years. Maybe by the end of this decade, we'll be seeing a lot of artificial intelligence being applied into our daily workflows, all within the legal and ethical landscape guardrails. So you have to pardon me, I have a bit of post-nasal drip, so I keep coughing in between. So I hope it will not disturb you. I am one of the LinkedIn top voices on the subject. Also, I have been featured in Forbes, and this is the Times Square where they appreciated my effort for teaching medical professionals to be future ready. Small disclosure, and let us move right into the talk. So I always like to start my talks with the big picture, like what is it that we are talking today, and some food for thought as well, so that this goes in the back of your mind during the talk, and by the end of the webinar, everything will connect and we'll complete the loop. So India is the most populous country in the world, and in terms of people and pain patients maybe, but I think we have very little number of pain physicians, qualified pain physicians. uh, there are there is very less time which we are able to give to a single patient, and especially in busy OPDs. So we all have been through that and we understand the problem. So if I want to frame it as a AI problem, so the problem is that we have more patients, and although right now we don't have digital data, we are having everything on pen and paper. So only 10% adoption is there of electronic medical records in India. But with time, as we have more and more electronic medical records, these patients will transform into more data. And with the explosion of this data, there is going to be very less time to make sense of whatever is coming in. So already places where they are using AMRs and multimodal kind of imaging modalities and everything they are collecting in digital health records, especially in Middle East where I was working, they are having this problem of too much data, like too much data, too much noise, and very little insights. So we are collecting data, filling them in silos, but very less is actually usable or actionable or available to benefit our patients. And this problem is going to be faced even in pain. And why I say this, because pain is not a condition which is a rare condition. It's a very common disease, very common problem. And once data explosion begins, 1 in every 5 Indian adults is going to give you data around pain. So this is just to give you sort of a picture, so that you can see where AI-enabled pain care fits in and why we are talking about this topic today. Although I still feel that we are talking about this topic ahead of time, especially in the context of our country, but still better if we are prepared so that we can build better data pipelines, we can build better AI solutions. As Sir said, that most of the solutions are coming from the Western world. So there's a reason for that. They have digital health records from a long time, and they're able to build the solutions. And for India, they want to test them. They want to use us as a testing ground, which I feel that if we don't develop our own AI, then we will only end up as a testing ground. So even pain physicians will have to contribute to this. And that is exactly why pain medicine is not futuristic. So people talk about AI in sense of future of healthcare, future of pain, future of this thing and that. But I think it's in fact overdue. We had to have digital medical records 10 years back. We had to have AI tools being developed right now and tested and validated in the next 5 to 10 years. But we are behind time. So this will be the agenda for the next 1 hour. 40 minutes to be exact. So I'll be taking you.
ये तो चल आपको लेट कर दिया
Yeah. So if you are not having any questions, so please if you can mute yourself. And if you have any question, you can put in the chat box or we will take it towards the end. So this will be a journey where you will see that how you can go from clinical complexity to intelligent patient care. And I will be covering these topics. Although 1 hour, 40 minutes is very less time to cover the topic of AI, especially, and that too AI in pain management. But I'll try to cover these pillars and give you some kind of information around these so that you can self-explore going ahead. And I'll be in touch. I'll share my contact details and you can get in touch with me if you want to know more and learn more. But this will be like a good overview of the topic so that you can, even if you're on 0, so after this webinar, you can call yourself that you have traveled the journey from 0 to 1. So before we go ahead, I have a small activity for you. So I hope you are having your mobile phones. If you are watching it on your mobile phone, then you have to go to your browser, internet browser, and you have to go to slido.com and you have to put this number. If you are on the laptop, you can scan this QR code from your mobile and you can just answer the question. So the question is, what's the first word that comes to your mind when you hear about AI in pain management? Or if not in pain management, what comes to your mind when you hear about AI as a topic? So I would like to know from few of you who are able to scan and get in, if you are able to get in. So I can see one participant is typing, yes. So I would like all of you to interact, because when you interact, then you will be able to understand and see how you are thinking and how your fellows are thinking. Because I do this exercise in every specialty class, and there are different answers for all. And that will decide the future trajectory of our specialty, which is pain management. So once we understand and more people answer, the most prominent one will get biggest. This is a word cloud, so the word will become bigger and the others will fade out. So I'll give you 30 more seconds to answer. I can see only 5 people have answered. So I think there are 34 people on the webinar. So at least 15-20 people should participate, and we have more activities like this. So if you participate, then I will also enjoy and you will also enjoy learning. Okay, 10 seconds more. I can see still people are typing. Yes, so some of the themes which are coming are diagnosis, treatment, clues. So robot has become a very common theme. Treatment, diagnosis, again, they are prominent themes. Precision, background information, clues, AI guided procedure, yes, pain scale. So we'll be talking a bit about all of these, and I will be having a complete section on diagnosis. Treatment part also we'll discuss. AI guided procedure also we'll have a look. Although each of these is a different webinar or topic or a workshop altogether, but I'll try to give you an idea about what is happening in which area. So let's move ahead. So thank you for participating. I'm assuming that most of us on this call are having absolutely no idea about AI and what AI is, except for the word and the hype which we see in the media. So when I was learning about AI, so I also used to have this confusion that what is AI, what is not AI, and I used to go online and search on Google, and I used to get hundreds of definitions. Each definition was different. But then I formed my own concept by learning about so many definitions and going through a lot of courses. I understood that AI is nothing but helping convert data into knowledge and wisdom. So as you can see, this is a pyramid. So there are 4 layers. The bottom layer is data, and this is where we have to work the most at this point of time as a country, as a profession, as a specialty. We have to digitize our data, collect our data through proper secure measures. Of course, the DPDP Act is going to be enacted, and that is going to change the entire scenario. So you need to have very good quality, robust data security measures, but that is not going to be an excuse for not collecting data. But this data is not going to help us unless we do something with it. So we have to analyze it, process it, so that it becomes information. And as we move up this pyramid, this is called the DIKW pyramid. So you can see D for data, I for information, K for knowledge, and W for wisdom. So DIKW pyramid, this is the name. And after applying a lot of processing, analysis, insight, judgment, then you reach the level of wisdom. And this is a pyramid which all of us as medical professionals are climbing on a daily basis, right from the day we enter medical school. We are fed with data which we convert into information, knowledge, and then ultimately it becomes professional wisdom. And AI is nothing but doing this process by machines or by using artificial measures, not naturally. And the process is called learning. So as you move above in this pyramid from the lowest to the top level, you are doing learning. And the ability to do this learning is called intelligence. So again, this is not a universal definition. Even intelligence has like millions of definitions depending on the context, depending on the geography, depending on social background. So all those things I'm not considering. I'm just giving you a very simple concept to differentiate natural intelligence and artificial intelligence, and understand that the basis of both type of intelligence is common. You are trying to move from data to wisdom. You are trying to make sense of data, and you are guided by context. So this is what is happening. So I hope now you will be clear what we are talking and what is AI. AI is not magic. It is only the process of converting data into wisdom. Wherever there is data, there will be AI. And this is another concept which people need to be clear on, is like there are 3 terms called AI, machine learning, deep learning. So if you are reading a lot of papers nowadays, publications are coming in each specialty with these topics and headings. So you should not get confused. So AI is the broad field. Like this is a circle. Within it there is a circle, and within that also there's a yellow circle. So this is a part of this, and this is a part of this. So artificial intelligence is the broad domain which covers everything which humans can do, or which a natural intelligence can do. If you are trying to mimic it, it is called artificial intelligence. But within this field of artificial intelligence, there is a small subset of field called, not small, in fact, it's a big subset. It's called machine learning. So machine learning is an area where you give the data and you give the labels. For example, you give 100 images of oranges, 100 images of apple, and you give the label, these are oranges, these are apple, and then you let the machine to learn itself. You don't tell it the rules that, okay, orange will be round, apple will be little like this shape. You will let the machine to figure out. It will find the patterns, it will find everything. So that is called machine learning. And when you give the 101st image, it will understand and recognize whether it's orange or an apple. So that is called machine learning. Machine learning is not the only way of doing AI. There are many other ways also, but machine learning is one of the ways. So all machine learning is AI, but all AI is not machine learning. And similar concept applies to this, which is deep learning and machine learning. So deep learning is something which is a very advanced form of machine learning, especially in the last 10, 15, 20 years. This field has come up, and whatever image intelligence you see, vision intelligence, speech intelligence, natural language processing, all these are applications of deep learning. ChatGPT, Gemini, all these Claude, these generative AI tools which you are seeing, these are also an application of deep learning. They are even more advanced form of deep learning. So now I hope the idea of putting this slide with I cannot move ahead without telling you this, because then you will not understand anything. So this is the bare minimum amount of knowledge of AI which you are supposed to have. Of course, this is not enough. It's not comprehensive. You need to learn more. And as you read more and more articles and papers, you will come across more terminology. But in this webinar, I cannot cover more than this. So I'll just move ahead and keep this in your mind. Keep this in the background, so you will understand what we are going to talk in the next slides. So just to show you what deep learning looks like, it looks like something like this. And this is why it is called a black box, because the data enters from the green side. These are nothing but neurons. Like we have in our brain, we have neurons. So there's a body and there are dendrites and there's an axon. So similarly, these are all neurons. And these neurons in one layer are connected to neurons of the next layer. And these red layers are called hidden layers because they are between the input layer, which is green layer, and the output layer, which is yellow layer. So what happens is data goes in from this side. So the data might be any kind of data. It might be images, it might be sound, it might be text, whatever is there, it goes into this side and it comes out of this side as an output. So output can be a prediction, it can be a classification, it can be the next word. For example, in ChatGPT and all, what it is doing, it is just predicting the next word based on the previous words. So the previous words become the input and the next word becomes the output. And this process keeps on going in cycles. And then you get an entire paragraph or a complete article. So that is the process. And this is also now helping in biology, because in biology, there's a lot of complex data. There are, for example, genomic data. So that genomic data, you cannot see the patterns with your eyes or images. Some crude things you can see with your eyes, but very fine things sometimes you miss as a human. It's a human limitation. But then human has advantages also. So there are pros and cons. So one of the cons of humans is that we cannot understand patterns in these kind of complex scenarios, which machines are very good to do. So machines can see the patterns which are invisible to human eyes, because they are operating on this kind of infrastructure, and this is all going on electronically. So every bit of information is being transmitted to the next layer through these connections, which are not actual connections, they are electronic connections. So this is how it works. And this is very fast. Like you push it from this side and it comes out from the other side almost instantaneously. You must have seen ChatGPT. So the moment you enter your query, it starts typing. So that is the speed, which is not humanly possible, and why we should do it when machines can do it for us. So, but what this will help us is, it will help us in going under the surface of water. So what we have been practicing till now for the last 150 years is evidence-based medicine. But now we have the opportunity as a medical profession to go to this zone, which is called intelligence-based medicine. So imagine you have data from all the clinical trials. So to conduct a systematic review or a meta-analysis, it takes almost, I am doing a systematic review myself. So it takes around 2 to 3 months to do a systematic review, proper systematic review. But with the help of tools which are coming up, like open evidence, which is not available in India, but in the US, you can get real-time information, like what is happening right now in my geography and what is the evidence. So the level of evidence-based medicine has now elevated itself, and now it is moving towards intelligence-based medicine with real-time insights. So suppose you can run a clinical trial in silico, you can run it within the chip, you can collect data from all your hospitals in your region, if they're all digitally connected to a central system, and then you can run machine learning algorithms and you can gain insights that, okay, what is the pattern of antimicrobial resistance in my region? in my group of hospitals. So it becomes more personalized, it becomes more relevant and more actionable. So that is what is the promise of AI. So AI will help you to see what you have been missing. So this is the biggest promise, be it pain medicine, be it critical care, be it any other specialty, be it non-medical field also. The basic promise of AI is to help you see what you have been missing. And I think this is a very big advantage for us medical professionals who want to give the best for our patients. I think whoever wants to give the best to their patients, and due to any limitations of present systems, we are not able to do it, we should explore AI. Because you can see AI can help in all these areas, right from treatment planning to treatment delivery. So I'm not saying that it is already out there and it is already being done, or you have been left behind and world is moving very fast. No, everyone is moving together. We are all trying to learn, we are all trying to apply, especially in a very niche area like pain medicine. Still not many studies are available. You can see this is a systematic review from 2025, and you can see the number of studies, only 24, 22, 26, 16, 32 in these areas, like right from treatment planning to treatment delivery. These are the application areas which are being explored. So we'll see them, we'll see a few of them in this webinar, and others I think you can explore on your own. If you go to PubMed and just type AI and acute pain prediction, AI and treatment decision aids, AI and chronic pain prediction, you'll get a lot of studies which you can go through and try to understand what is happening. And nowadays you have ChatGPT, you can put the paper into ChatGPT and ask it to give you some brief summary and simplify it to your language. So all that you can do. I'm just showing you the way. Like the task of the teacher in the era of AI is to show the student the way. It is not to transfer information, not to transfer knowledge, because AI is available to everyone and everywhere. So I just have to show you the way, the direction, and how you have to go ahead. So I consider that my responsibility. So these are the areas: medication and dose response prediction, acute pain prediction, then opioid misuse prediction, real-time treatment tailoring. Ultrasound machines nowadays are getting AI guidance, self-management applications like chatbots and all, treatment decision aids, CDSS, which is a short form for clinical decision support system, chronic pain prediction. So one of the common themes which you will see is prediction or classification. So AI is good at these two things. Either you want to predict something or you want to classify something. प्रिडिक्शन का एग्जांपल क्या हो गया कि मैंने दवाई दी तो फायदा होगा कि नहीं होगा, कितना होगा, नहीं होगा, पेन, I did a procedure, now I want to see the possibility of a complication, prediction. So that is prediction problem. And classification problem is, suppose I have 5 patients of chronic back pain, and I want to understand that which patient is having neuropathic pain, which is having nociceptive pain, which is having mix of both. So that will become a classification problem. So AI can help you both in prediction and it can also help you in classification. So whenever you have such a problem, you can always think of applying AI to it, provided you have the correct data. As I showed you, data is the foundation of everything. If you don't have data, you will never reach wisdom. So that is beyond debate. Okay. So whenever you talk about AI to me or yourself or to anyone else, first thing, do you have the data? If you don't have the data, start collecting data, start digitizing data, start respecting data, start understanding the value of data, which is called data literacy. So we have to, as a nation, we have to understand that our data is very important. And you must have seen in news that many telephone companies are now giving tools like ChatGPT and this Gemini for free. So why they are giving it? Because they want your data. Because you are the biggest data generator in the world, biggest population of data generators, and they are ready to give the tool for free just for you to generate data. So this is why I want to emphasize upon this too much, because in every webinar I go, in critical care, this problem is not that much because they already have digitized systems a lot. But for us, I think we have to leave the pen and paper and start moving to digital area. Then only we can move to AI. Till then, we'll only be consumers. So let us go one by one. Now let us see diagnosis, then we'll see treatment and rehab and all those things. So how AI can transform diagnosis. So pain scale, for example, pain scale we are using, we always ask our patients, pain batao 1 से लेके 10 में कहाँ तक है, या 100 पैसे में कितना आराम हुआ. Means we are still using those old kind of methods, although I'm not criticizing them, I'm not saying that they don't work, they work wonders, but they are very subjective. So मेरे लिए 1 और दूसरे के लिए 3 और तीसरे के लिए 5 वो एक ही हो सकता है. तो ट्रीटमेंट तो एक नहीं होगा ना, मीन्स इट हैज टू बी डिफरेंट, इट हैज टू बी पर्सनलाइज्ड. So how do I get an objective measure, structured measure, which is in form of data, which I can use to inform my decisions as a pain clinician? तो उसका ये example है. This is one of the examples, not the only one. So what they did is, whenever you see a patient, I know experienced pain clinicians can tell from the face of a patient that patient is in pain. Now, how is this possible? Because their brain has been trained so many times on identifying pain that उनके अंदर का जो machine learning, deep learning जो model brain में है, that is able to identify. But for a new physician who is just passed out of the pain fellowship, I cannot expect him to recognize this kind of pain right from the face. So there is something called vision intelligence, which I was talking. So deep learning में क्या होगा? It will just capture the image, or maybe if it is a continuous monitoring, it will do a video surveillance, and it will see pain-induced facial expression. So this machine has been trained on millions of data, millions of images of people, and the pain scores, and using, of course, vital signs and all those things are also gone in while training the machine learning algorithm. And then this machine learning algorithm is able to classify. So you can see a graph. You can see these are the patient points. These points are all patients, and the blue one is the one in pain, and the gray one is no pain. So the algorithm is able to classify the patients into pain or no pain. And this is just a very crude example. You can also do pain scoring on this. Means once you have enough data and you have enough training of algorithm, it will start predicting किस level का pain है. So you can see the first level is pain detected, and then the next level can be pain intensity. So this can give you a standard objective measure of pain. Of course, you keep asking pain score कितना पैसे में क्या है, but then you can double check with this kind of a system. कई बार ऐसा भी होता है, patient malingers also. I'm not saying that all patients do it. Sometimes there is some kind of reason to malinger. So maybe this can also help you in a medico-legal kind of a way, because this is objective. This is having a probability attached to it, and you can cite it, you can quote it. You can say that, okay, this is why I did this, but subjective का तो कोई explanation नहीं होगा ना. So at least from that, this is better. Although again, the caveat is regulations are still not there. It might not be considered as proof in court of law, as sir said. Still, rules and regulations always lag behind technology, but धीमे धीमे वो आ जाएगा, it will come. So you have to know this. Second step, अभी हमने सिर्फ vision देखा, we just took vision. Now similarly, you can take so many things. You can take vital signs. आजकल everyone has a smartwatch. I am sure everyone on this call is having a smartwatch. You can get semantic location, because I think most of you are using Alexa. Most of you are using some kind of Wi-Fi, IoT kind of devices. And then of course, you can have smart this spectacles, and most of the companies are now coming out, and gradually you will not have to wear that bulky set, but you will just have to wear a simple spectacle like I am wearing, and it will have everything inside it. So it will also monitor your certain parameters, and all this can be used to convert subjective pain stories into structured data. I just want to throw an idea to you. I'm not saying it is available out there and you can use it tomorrow. No, you cannot. But you can try to build some kind of tool like this. You can work with the engineering team. You can maybe collaborate with some people who are building these kind of things, and then you can give your ideas and build something which might be one of the areas of this multimodal tool. And when we have so many multimodal tools, when we connect them all together, then we will get a complete picture. So this is to show you that it is not just limited to face. You can also go around and play with other parameters also. For example, they took a socio-demographic parameters in the electronic medical record in the West, and they understood that loneliness is also a factor of non-adherence to treatment, which makes sense, right? Because we also as doctors, we know अगर कोई patient को हम बोलेंगे कि तुमको दिन भर में ये करना है, मार्केट से ये लेके आके खाना है, बट उसके घर में कोई है ही नहीं जो उसको ला के दे दे, या वो नहीं जा सकता लेने बिकॉज उसका तो पैर टूटा हुआ है. तो हाउ विल द न्यूट्रिशन एडवाइस विच वी आर गिविंग और लाइफस्टाइल एडवाइस विच आर गिविंग बी एडहियर टू? इट विल नॉट बी. तो उसको we have to uncover and we have to address it. So that is what is all about AI. AI means early detection, early diagnosis, early treatment. The diagram which we used to read in PSM, primordial prevention, early prevention and that kind of thing, वही है AI का promise, वही है, वही करना है. So I told you an example. जैसे इलेक्ट्रॉनिक मेडिकल रिकॉर्ड में से जो पेन नोट्स होता है, those can be converted into analyzable data. Like I told you, कि loneliness is leading to non-adherence of medication. It is not because of patient factor, it is because of social demographic factor. So those things can be uncovered by using NLP. NLP का full form है natural language processing. It is nothing but a type of deep learning जो हमने डायग्राम देखा था. एंड विजन इंटेलिजेंस इज वन जो इमेजेस से डील करता है, एंड एनएलपी इज वन विच डील्स विद लैंग्वेज, टेक्स्ट, स्पीच एंड ऑल दोस थिंग्स. Then I told you an example already, classifying pain, nociceptive है कि neuropathic है कि mixed है. Of course, I know most of the pain clinicians are trained in doing this, and it's very easy also many times. But sometimes we also face dilemma कि what kind of pain. Sometimes after we give treatment, then we realize okay ये तो neuropathic pain था. तो ऐसा भी होता है. तो इफ वी कैन सेव दैट काइंड ऑफ सिनेरियो, तो आई थिंक दैट्स गुड. देन ट्राइजिंग के लिए भी, बिकॉज ऑल पेन इज नॉट टू बी ट्रीटेड एंड मतलब टू बी ट्रीटेड इन अ मैनर विच इज एग्रेसिव. और जैसे कहते हैं ना, टू किल अ फ्लाई यू डोंट नीड टू ट्रिगर अ न्यूक्लियर बॉम्ब. सो उसमें ट्राइजिंग डिसीजन मेकिंग, क्लिनिकल डिसीजन सपोर्ट, उसके लिए भी AI कैन हेल्प यू अ लॉट. But again, provided you have good data and you have algorithms which are built in India for the Indian population. Unless that happens, you are not going to get much benefit out of already existing algorithms out there. You can use them, you can test them, you can validate them in your population, in your clinic, in your geography. And if you find them useful and they are able to economically viable भी होना चाहिए. Means some subscriptions of these AI tools are in dollars and they are too expensive. So who bears the cost? Then you will have to ultimately take it from the patient. So then if that tool is not making much of a difference and you are charging the patient for it, so again that becomes not. Again, it can be ethics issue and it can be difficult to implement in Indian scenario. So those things also you have to see, but definitely it can help in better triage and reducing the diagnostic variation. So sometimes there is inter-physician diagnostic variation also, which to a certain sense, a certain level is good also, because तभी तो misdiagnosis मिलेगा ना. कई बार नहीं catch कर पाते हैं. Our colleague is not able to catch, but we are able to do it and then treat the patient, and vice versa. तो अगर diagnostic variation नहीं होगा, बिल्कुल zero हो जाएगा, वो भी it is not good. But then again it should not be that. It should be कोई तो 0 बता रहा है and कोई 100 बता रहा है, तो that variation should also not be there. So that is again AI can help in those areas. So red flags, again, one area which we have to be very careful of as pain physicians, especially when we are doing a procedure, and especially when we are treating the patient and suddenly the patient develops red flags. So there's something called predictive surveillance, predictive intelligence. I told you it is very good at prediction, but you can also do this on a continuous basis, because now we have medical devices, we have wearables, we have in urban population especially, they are very, very tech savvy and they are very conscious. So you can also teach them to use an app which they can use, and they can that app can keep monitoring or giving them nudges कि अभी pain कैसा है, अभी pain कैसा है. तो you can get alarm before something goes wrong, like means preemptive prediction of the problem. So that is also a huge area where AI can help. Okay. Then imaging, which is a big part of our diagnosis. So MRI, CT scan, ultrasound. So that is another area which is being already impacted by AI because it's a part of radiology. So वो radiology ही as a field is being transformed by AI. So those effects are also transmitting to pain medicine. तो जो इंटर रीडर वेरिएबिलिटी था कि someone used to report the canal as itne millimeter, someone used to report as this much millimeter. So all those things, those variations are going to go off with time. Quantitative image metrics से क्या होता है, you can help link the anatomy. So पहले क्या था, image अलग आ रहा है and patient का history अलग है, and you have to link both and then you have to correlate. But now with the help of AI, especially जहाँ electronic medical record है, the radiologist can pull in the history of the patient from the electronic medical record, and then they can correlate it with the image and then give you some kind of a insight by applying AI tools. So that is also becoming possible now. So ultimately what this is going to do, it is going to make it faster, more efficient, it is going to shorten the decision time, and it is going to improve the accuracy. So ultimately तो ये होगा. So this is just one example I want to show you how it is done. So this is nothing but vision intelligence. Again, I showed you, it has been trained on thousands of MRIs, thousands of doctors have labeled these kind of structures, and then it is trained. And now when I give it a new image, it applies that AI model and it gives me those structures. It label करके देता है कि ये thecal sac है, ये posterior है. So you don't have to guess it. It gives very good accuracy nowadays. Image accuracy is even more than human reader. अभी तो ये, this is the level of image AI in radiology. Okay, and sagittal scan में भी ऐसे it can show you the different vertebra, discs and canal and all. It can show you very clearly. So, and this is not done by human, mind it. This is the power of AI. AI can do this for thousands of images per minute, per second. जबकि एक human को ये बनाने में, ये करने में, I am not saying human will not be able to do it. They will be able to do it maybe even better. But to do it at scale, at speed, and do it without getting bored, I think that is what is the use of AI. And similarly, you can see, I'm not practicing pain medicine anymore, so I have lost touch, but we used to see the central canal, left foramen, right foramen, how much compression is there. And the numbers that you see, these are the probabilities. So the confidence level of the model. So the model is 93% confident that in the left lateral side, there is mild compression. So this much information you will get. You will not get only this image. You will get this much image now because of AI. So this is what is changing, and it will only improve with time. So I hope I'm making sense till now. So I have around 15 more minutes, and majority of my talk I wanted to focus on diagnosis because this is one area where all of us are looking towards it, and I could see in the word cloud that diagnosis was a big area. So not just diagnosis, after the diagnosis, when you start treatment, you want to know which treatment. Sometimes we are confused that which treatment to give to which patient and whether it will be effective or not. What is the chances? What are the probability? Even patient asks us. We tell them from our clinical experience knowledge. But if we have some kind of objective way to do that, then that is also one of the promises of AI, like which patient will benefit from which therapy. And in a way, it will prevent trial and error kind of treatments and make it more cost effective. Sometimes procedure is done which doesn't give that much benefit, and of course it's a part of the treatment step up ladder, but then we could have prevented it altogether and gone for the higher level treatment right away. So that is one area. Okay, so I'll just move through this. You can feel free to take screenshots, and I think this is getting recorded and it will be shared with you, so you can see this in your free time, but this is the main purpose. Then ultrasound machines, I'm sure many of you must be using the newer ultrasound machines, and they can again annotate those images like we saw in CT scan. So similarly in the ultrasound image in real time, you can see where is the nerve, where is the vessel, where is this. And so overall, 2-3 benefits. One is in difficult patients, obese patients, you can have better accuracy. Then it can be used for better teaching of medical students. And third thing is it can prevent complications. Sometimes inadvertently complications happen, and those can be prevented by using this kind of image guidance during pain procedures. So that is another area. Okay, so all these things can be avoided. And nowadays, even in fluoroscopy images, fluoroscopy machines, this thing is coming where it can use AI to optimize the dose of radiation, and it can reduce the dose and give you similar or better quality of images. It can use AI to enhance those images. And that is also helpful for us as pain physicians doing procedures. We don't want to get exposed to too much radiation also. So that is another area. So now time for the next poll. So for those of you who had done the poll already, it will be open in your mobile phone browser. You can just go and you have to rank these. These are the areas where AI can impact. And I want to know from you, which is the biggest area of difference which you find in your knowledge, which will be affected by AI. So it can be pain diagnosis and triage, it can be image and scan interpretation. We saw some examples of all these: predicting treatment response, guiding procedures and nerve blocks, rehab and patient follow-up. So let us see what our group thinks, where AI can make the biggest difference. Of course, I know image and scan interpretation will be a biased choice because maximum work is happening in that area, especially in radiology. And that is something which is not directly related to us pain physicians. But I think the other areas are quite related to us. Interesting. Good. So predicting treatment response. I know it can help us definitely as pain physicians because we are having a lot of problem in this area. Having practiced pain medicine myself, I know, and I can say for that. I don't know if things have changed in last 5-6 years, but this was a big problem area in our practice also, especially when I was doing fellowship. And that is why the role of diagnostic blocks and all. We do a diagnostic block and then we do a complete RF, or we apply the main medicine after we have confirmed with a short acting local anesthetic. So all those things we have tried to somehow improve our accuracy and our treatment. But then if you use AI along with it, then maybe you can get a better prediction of treatment response. Guiding procedure and nerve blocks and imaging scan interpretation is already happening as we speak. Pain diagnosis and triage, yes, this area is going to come up in big way in times to come. But as I told you, you will need more data around this to reach a good amount of accuracy in the Indian population. And again, of course, you have to go through the regulatory thing. So whenever someone comes to you selling you a pain diagnosis AI, you try to be very clear with them, ask them which data is it trained on, which geography it has been validated in, and is it certified by the Indian authorities, especially the CDSU. For India, FDA, like FDA is for the West, for India it is CDSU. So they are now formulating some guidelines for software as a medical device, as the sir said before my webinar. So you should be aware about those things before applying these tools in your pain diagnosis to be safe also medico-legally. So you have to do good for the patient also, and you have to be safe medico-legally also, and you have to improve the efficiency of your pain practice also with time. So all these things have to be done. So the last area, which is rehab, let us go through it also. So rehab, I think most of you will be aware because you are from PMR background, and I'm no one to teach you about this area. I'm not an expert, but there are some things which are happening in this area where you can now do kind of remote monitoring and because there's a lot of drop-off reasons, especially in India, patient coming just for exercise session or a physiotherapy session. It looks good on paper, but sometimes it's not practical. So especially with the 5G and all, we can have some AI-linked apps and wearables, and I guess some of you might be even using them and working on them, validating those. This is one of the tools which I could find. I don't know if it is already applied or already applying or applied and shut down. I don't know, but this is one which I found interesting. Is you can track the body movements and the angles and all the things, and this you can do over time. So you can see whether it has improved, it has reduced. So if you find that the patient not able to flex before they were able to flex, you can call them to your clinic. So you can do that kind of triaging, and then you can also add a human layer to it by remote guidance. So this is something which is interesting. More and more will come up. And this is one example where not just physiotherapy, but in fact the entire patient pain journey. I wanted to show you this one example where the patient with back pain lands into the clinic and then they are enrolled into a remote monitoring program, because we know as pain physicians, back pain is not going to go away in one day, and it is going to be a long journey, sometimes short journey as well for some patients, lucky ones, but then for some it is very long journey. So better to enroll them in a remote patient monitoring program, and then they have apps and kind of wearables which they give to the patient, and they have those questionnaires on those apps which the patient has to fill repeatedly, so that instead of maintaining a pain diary, pen and paper, they can do it on the app, and that app is being actively monitored daily by some kind of nurses, dietitians, physiotherapists, and all multidisciplinary team, which is going to monitor, and the specialist also has full access. And whenever the patient develops some kind of problem, they are called, and the physician can attend, or maybe between the follow, between the visits for the follow, this process can be used. So this is not something which is future or which is fiction, which we are talking. This is already happening in some places of the world. And I don't think there's any problem why it cannot happen in India, especially in maybe in some urban centers to start with, where there's good internet connectivity. So we can try these things. All this technology is available. This is what I want to highlight. The AI layer will develop itself once this data layer is secured. So finally, moving to the last part of my talk for another 5 minutes. This is what we talked about. This AI, whatever we talked till now, is kind of non-generative AI, the discriminative AI, or the AI which was there before 2023. 2022, 2023. So, but now there are so many AI tools available out there. Earlier, what used to happen is, for you to experience an AI tool as a clinician, as a doctor, you had to go to a research lab and then use an AI tool. But now you only need an internet, mobile phone, and laptop, and you can use these kind of tools to do these activities. It is very difficult to cover all these tools in one webinar, but I want to show you some tools. This is the Medical Futurist. If you have not subscribed, please subscribe to his magazine. He gives a lot of very good articles like this. And you can see these are some of the apps which you can explore. So if you are wanting to create a PowerPoint presentation, you can use Beautiful AI. You can use Humata to communicate with your PDF documents. I think this is GDPR compliant also. You can use it as a doctor. Then to make your own website, to do text-to-speech conversations, all these tools are useful for medical professionals. This is not the complete list, but they are coming up as we speak. It is very difficult to keep up, but you can use at least 2-3 AI tools which are useful for your workflow, and try to use them. So these are some examples I will show you. One is for documentation. So if you have not already been using electronic medical record and you want to start using it, it will be very difficult, because most of your time will go into typing. The patient is looking at you, they are giving history, and you are typing. So to avoid this problem, now they have something called AI Scribe. So it is just like an app, or you can also keep it as a device on your table, and you can just switch it on and you talk to your patient. And while you are talking, the AI software is listening and it is converting it into a note, which it will give you to just check and sign and put into the system. So this is one kind of application which you can do right from tomorrow. You can do it. Then you can also use AI to educate your patients. You can use AI to generate leaflets, maybe about back pain, about trigeminal neuralgia. You can create them in their patient-friendly regional language in a short amount of time. You can put FAQs also. You can do all this now using AI. You don't need a complete marketing team to do it for you. You can do it yourself. You can summarize clinical papers for quick evidence checks, as I told you before. And also it can help you in getting your publications out faster. Of course, you have to use it in an ethical way, but then it can help you in a lot of areas for your research work also. So these are some AI tools and areas of generative AI which you can use straight away. This is a complete workshop. It's a complete webinar. It's a complete one-day conference also can happen on this topic with generative AI tools for doctors. But I think for this webinar, I think this much overview is enough, and any of you who are interested more can get in touch with me. So all in all, what is the promise? The promise is to get a personalized kind of pain medicine for patients. integrating everything together and giving a real-time means real-time analysis, real-time picture, and then individualizing the treatment and personalizing it for each and every patient. Right now, we are catering to groups like low back pain. Within low back pain, there are 4 or 5 categories, and every patient who is diagnosed of that particular category is treated the same way, or slight differences there. But to make it more individualized or personalized, this is how it is going to happen. And I will show you one concept of smart pain clinic also. But before that, a word of caution, which sir already said before I started my webinar. I would like to just reiterate it, that any AI in healthcare at this point of time, not just pain medicine, it should be used with safety. You should confirm with the vendor whether your tool is FDA approved, it is GDPR compliant, DPDP compliant, HIPAA compliant. All those things you have to confirm. Then you have to supervise it. Automated AI tools at this point of time, they are not reliable enough to be applied in your workflow that automatically it does everything. They should always be supervised, and always a healthy skepticism should be there. Skepticism can be of two types. It can be pessimistic skepticism and cautious skepticism. I am also a skeptic, but I am optimistic about it. I am cautiously optimistic that, okay, if we are able to put the good guardrails, good ethical guardrails, we are going to get good AI for our patients and for our pain practice. So you have to always focus on this responsible use as clinicians. Okay, whatever new fancy tool comes tomorrow, you have to be responsible. Ultimately, AI cannot take responsibility, only human can. And again, data quality is going to hamper your prediction. So you have to always focus on data quality. Always get a good EMR, good electronic medical record, spend good money on it so that you get good data to apply AI tools later on. Okay, because AI cannot fix bad data, it only amplifies it. And this is one concept of smart clinic. So you can maybe take a screenshot, and these are different areas where robotic surgery you can change with pain intervention. So you can customize this to pain. This is a diagram from L&T. So L&T, you know, if a company, it's Larsen and Toubro. So they are building hospitals, big hospitals. So this is their concept of a smart hospital in future. So this similarly, this thing will be applied to smart pain clinic also. Okay. So finally, AI won't replace doctors, but doctors who use AI will redefine care. So if you want to be a person who wants to redefine it and not just follow the old trends, so you have to look towards AI, and it is already here. I showed you so many examples. Clinician will always remain central, and smart pain clinics are the future. So let's talk about how can we make it real, but of course responsibly, clinically, and together. So last question before I end is, if your pain clinic could use AI for one thing tomorrow, what would you choose? So you can answer anything you want, and we can have at least 4 or 5 answers to see if my talk was able to give you some ideas. If your pain clinic could use AI for one thing tomorrow, what would you choose? So whatever we learned till now, whatever struck with you the most, and you feel that if I had to build an AI tool with an engineer for this problem tomorrow, I would do that. So this can be the bottleneck which you might be facing. This could be something which you want to solve for it, and you have been facing this problem from long time, or you have been solving it in some way which you feel is not efficient enough, and there can be better ways to do it. Very nice. So I am very happy to see that you are answering, and you are answering very correct things, because all these things are going to matter for future of pain medicine and as a pain physician. So I hope some of you will come out with these tools, come out with these kind of softwares and apps, and you will be a doctorpreneur in times to come, and not wait for engineers to build it for you. In fact, you will come forward, and since you have identified this problem now, and you know AI can help you solve it, now you can explore this further. So I will leave you with this thought and vision that future of pain care is human plus AI. and it will always have to be the empathetic human who will be able to listen to the patient, put that kind of information into AI and get insights and then apply it to the patient. Because any other field, any other specialty, I can always debate and I can be confused and I can agree with someone that human will be replaced. But in pain management and pain care, having practiced it myself and being an anesthesiologist by training, I know that pain is one area. जब जब दर्द होता है ना, तो you need a human hand, you need human touch, you need a human doctor. So we pain physicians are very lucky that we are having such a human touch kind of a specialty where AI can make us better pain physician. It will not replace us because this field is such, pain care is such where you will need humans and human touch and human empathy, because if you can't feel the pain of the patient, you can't treat it. So thank you with that, and you can take a screenshot of this slide and you can connect with me. The QR code is there. When you go to the QR code, you can connect with me on socials, and you can also drop an email to me and I'll be happy to respond. And I can see many of the known names in the attendees, and I am already connected with few of you, and looking forward to more discussions. With this, I'll end and I'll hand it back to Dr. Minaj if we have any questions. I hope I have not overshot, but I wanted to give you a
No,
good...
thank you, boss. Such a
Thank
nice presentation, very informative. There are some questions in the chat box.
Yeah.
I would like to the question asked by Dr. Sanjeev Kumar Sharma. Any AI tools available in which we can upload USG images, clips, and we can get instant differentiation between normal and abnormal finding?
So, Dr. Sanjeev, there are tools out there. There are, I'm not aware about the name exactly because I'm not practicing it, but if you go and you search, you definitely get tools. There are tools for ECG, for example. I will tell you the concept is same. You take an ECG, you take an image, you upload it to the cloud, you have some kind of algorithmic model running in there, and that is going to triage the ECG. It is going to give you a preliminary diagnosis. And it's not like the diagnosis which you used to get from our ECG machines. It is going to be very accurate and it's going to come up with a cardiologist in the loop. And so that is the level of things where people are operating right now. There are many startups who are working in this area. If there's no tool available, you can maybe validate some tools of some people out there. You can upload some reports, try to get some results and see if they are really good or not. You can score them. You can help them in validation. So there will definitely be tools. Answer is yes, but you have to find more about them, and I'll also have to explain. Thank you.
So next question is how much financial burden it will cause to the department and patient? Is it going to decrease the cost of the treatment?
So in the long run, it is going to definitely reduce the cost because of all the reasons I told you. If you are able to better predict, if you are able to better classify, if you are able to better catch them in time and treat them, definitely the hypothesis is it will lead to lower complications, it will lead to lesser treatment time, it will lead to lesser use of medications, and it will lead to reduced cost. But definitely any new technology that comes in has an upfront cost to it, mainly because the infrastructure is not ready. We don't have electronic medical records. So first you have to buy electronic medical record, and that itself is an investment. Once you buy an electronic medical record, you will start harvesting data, which then again you will have to process. You will have to use some AI tools to process that and bring insights, which will again have some kind of subscription cost. There are no free lunches. If you are using free tools, be very careful. They might be harvesting your data and selling it somewhere. So that is another area why you should prefer paid tools. So answer to this is definitely it has an upfront cost. So if your setup is like for robotics also, this question comes up a lot when I go to robotic surgery conferences कि robot लेके आएंगे तो cost effective रहेगा कि नहीं रहेगा. So it depends on your volume also. अगर आपका volume अच्छा है, if you are in a busy center, in a high volume center, that is when it makes sense actually to bring a robot. अगर आपका सिर्फ एक छोटा सा क्लिनिक है तो start with generative AI tools which I showed you to bring efficiency into your other process areas, and don't touch these diagnostic tools and those treatment prediction tools. Go for them later on. अभी पहले आप अपना basic administration का जो cost है, marketing team का जो cost है, there you can save a lot of money, right?
Sir, one question from Ganesh sir. Does AI use the personal identifiers fed to fetch answer from AI?
Yes. So यहीं पे मैंने जो 2-3 नाम लिए थे, I took name of HIPAA, I took name of GDPR, I took name of DPDP, and sir also told before my webinar कि DPDP Act is already now, it has become a law in India, and the rules have, I think, been ratified, and it will definitely be implemented in times to come. Every hospital needs to have a chief data officer, chief consent officer, where they are responsible for the consent of the patient. Patient is the owner of data. और आपने गलती से भी अगर पेशेंट का डेटा डाल दिया, आपने अगर सही गार्ड रेल्स यूज नहीं किए, आपने अगर चैट जीपीटी में पेशेंट की हिस्ट्री ऐसे ही कैजुअली डाल दी उसके नाम के साथ, फोन नंबर के साथ, तो आप ये मान के चलिए वो चला गया डेटा, इट हैज गॉन देयर, एंड भगवान नहीं करे अगर आगे कुछ हुआ, कुछ गड़बड़ हुआ, तो देन यू आर डेफिनेटली रिस्पॉन्सिबल बिकॉज यू हैव लीक्ड पेशेंट डेटा. तो वी हैव टू फर्स्ट बिकम डेटा लिटरेट. मैंने इसीलिए बोला डेटा लिटरेसी इज वेरी इंपॉर्टेंट. हमें अपने डेटा का वैल्यू, उसको कैसे प्रोटेक्ट करना है, कैसे सेव करना है, पेशेंट को भी कैसे बचाना है, वो करते हुए एआई को यूज करना है, उसके बिना नहीं करना है. वो तो मतलब देयर इज नो डाउट अबाउट इट. इट इज नॉट कि कर सकते हैं कि नहीं कर सकते, नहीं कर सकते. और उसको कैसे सही तरीके से करना है, उसके लिए रूल्स एंड लॉज आर कमिंग, एंड देयर विल बी सम सॉफ्टवेयर विच विल बी कमिंग विच विल बी डीपीडीपी कंप्लाइंट. तो आप डीपीडीपी कंप्लाइंट सॉफ्टवेयर यूज करिए और इंश्योर करिए कि आप सारे लॉज को फॉलो कर रहे हैं और फिर एआई डेवलप कर रहे हैं या यूज कर. सो दैट इज सेट थिंग. आई थिंक सर कैन ऐड मोर टू दिस because sir has more experience and more he has worked in the regulatory and directorate general and kind of setup. So I think sir can add more insights to this particular point. Yeah.
I think you have given a good background to them about the regulatory component, so that the data you generate is right data, safe data, and before you feed it for any type of solutions, you have to be cautious about it and try to do a responsible job. And as such, as on today, there is nothing more except DPDP, there is nothing more. But in future, we hope that the things will come in a better way. Even our Aadhaar number, EHR, our other things which are there, the registries, the Digi Doctor, all those things are probably very, very initial versions. They will mature in due course of time. So it is rightly said that let us try to take betterment of our clinic by applying AI as much as possible, cautiously, and try to be compliant to at least all national laws if we are using it in Indian setup.
Completely agree, sir. And there is something called off-label use. So we are using medicines as medical professionals. So we use in them for on-label indication and off-label indication, something like off-label. Similarly, AI at this point of time, if you are using it, use it for low-hanging fruits first, like administrative tasks. And then once you are sure about it and it is properly validated, then you go for diagnostic and treatment support kind of uses that will save you medical legally. This is one thing. And one more rule I will give you: if AI is suggesting to you standard of care and you reject it, then you have to be very careful. And if AI is suggesting to you non-standard of care and you are accepting it, then you have to be very careful. So ये दो condition में you might be medical legally liable if the patient has injury. But उसके अलावा if you are going with standard of care which has been gold standard, and if AI is suggesting against it, and if this injury happens, you are not liable because you followed standard of care. But if AI is suggesting standard of care and you reject it to do something off-label and the injury happens, then you will be doubly medical legally screwed in a sense, because the AI was suggesting to you standard of care. तो ये ध्यान रखने की बात है.
So, boss, how can we differentiate कि जो AI information है वो accurate or not?
तो आपको स्टैंडर्ड ऑफ केयर मालूम है, आपको स्टैंडर्ड ऑफ केयर तो मालूम है ना, यू आर स्टडिंग दैट. तो एआई जो प्रेडिक्शन देगा आपको करने के लिए, तो या तो वो स्टैंडर्ड ऑफ केयर होगा या नहीं होगा. अगर वो स्टैंडर्ड ऑफ केयर है और आप उसको रिजेक्ट कर रहे हैं अपने क्लिनिकल सेंस की वजह से या जो भी है, तो आपको डबली श्योर होना है, बिकॉज बाद में एआई तो करेक्ट था ना, AI was giving you standard of care and you decided to not follow it. और इसी का opposite, AI always gives a probability. AI is never going to be 100% sure. मैंने जो आपको image का example दिया था उसमें भी वो probability बता रहा था. तो it is going to be 89%, 93%, 94% probability. 0.001% वो डॉक्टर के ऊपर ही है, उसमें कोई कंफ्यूजन नहीं है. एनी AI पर्सन सेलिंग यू AI एंड टेलिंग यू कि सर AI आप यूज करो सर कुछ नहीं होगा और आप रिस्पॉन्सिबल नहीं होगे, प्लीज बी वेरी केयरफुल. अगर कुछ भी गड़बड़ होता है तो यू हैव फॉलोड दैट एडवाइस, यू हैव यूज द AI टूल, यू आर रिस्पॉन्सिबल. बट आप AI टूल डर के नहीं यूज करो और पेशेंट को बेनिफिट हो सकता था वो नहीं दो, तो वो भी हमारे प्रोफेशनली आई डोंट थिंक इट इज ethically correct. So we have to find a balance right now in each one of us among ourselves, but regulatory guidelines laws will come up with time and more clarity will definitely be coming, as sir said.
One more question from Rishabh Sharma. Sir, any online course recommended to learn more about AI?
Yes, so there are many online communities, there are many online courses. I am also a part of few courses, so if you want to know about them you can get in touch with me personally. I'll be happy to help you and guide you.
One question from Dr. Soumya Saxena. Do we have any approved software to use, particularly in government setup, like we have recently being introduced to clinical key AI? What are the legal considerations? Thank you for the wonderful present. I think it is discussed already.
Yeah, so clinical key, the discussion again goes to that whole discussion of national laws and rules which are there. Agar if you are being supplied by clinical key from your government, so then again you are responsible if you follow the recommendations. It is not going to be clinical key who is going to be held responsible. Of course you can use the clinical key ने मुझे ये बताया था, but आपने उसको verify करना था. You have to verify it. So at present LLMs जो है, large language models, chat GPT and all, they can hallucinate, they can make up things, they can give wrong information. तो अभी के टाइम में for clinical decision support specifically should be very careful unless you are expert in that field. अगर आप पेन मेडिसिन में एक्सपर्ट है तो आप हेलुसिनेशन पहचान जाओगे कि ये गलत बता रहा है. For example, my dad is a dermatologist. He uses sometimes chat GPT to reason for his thing, but वो then he's an expert, he can identify. अब आप कार्डियोलॉजी की जानकारी लेने लग जाओ और गलती कर दो वहाँ पे तो फिर यू आर रिस्पॉन्सिबल ना. व्हाई यू डिडंट आस्क अ कार्डियोलॉजिस्ट? तो अभी ऐसा है, दिस इज द प्रेजेंट सिनेरियो, आई एम जस्ट टेलिंग प्रेजेंट सिनेरियो. डेफिनेटली इट विल चेंज इन फ्यूचर. तो अभी आप क्लिनिकल की यूज करो, पढ़ने के लिए यूज करो, use it to get real time information when you are seeing a patient, but then always try to verify it, check कहाँ से sources दिया, क्या site किया है, कौन सा citation है, before applying it to your patient. I think that is the way right now.
Okay, thank you, sir. I request to Dr. Srivastava sir for closing remarks.
Thank you. I think I am attending good number of such webinars who should be educative to me to learn AI. This is perhaps one down to earth type of discussion which I had only from Avneesh. So my congratulations to him. There are few words which I would like to speak to you. AI is in healthcare and we are unprotected as on today. But AI is in healthcare. Why I say so? That at present, if you look at, there is a guidance document for software as a medical technology and software in medical technology, which has been put up on the website of CDSO for comment of the users. It means that the government of India, the regulatory system, which is taking care of medicine, devices, cosmetic, etc., is considering it as a medical intervention and they want to regulate it. And that's why AI has got a status, an AI powered product, including the app we are talking about, the various algorithms we are talking about. They have got a value which is equivalent to drug, medication, and the medical device, and it is to be used with standard workflow, standard treatment guideline, and all other things which are there in the standard healthcare practice. And we don't have it for the AI and AI related product. So my first suggestion is first be literate about the data, because we are very, very poor at the data stage. Be literate about the AI, because we are just sometimes looking at the tail of the elephant, sometimes looking at the ear of the elephant, and feel that we know AI. No, we don't know. And the third thing is that when you see it, try to use it. Try to use it wherever you are comfortable, other than your commercial patient care. Because commercial patient care invites problem. Most of the problem comes in a commercial patient care. Gradually, you will learn that where to use it, where not to use it, including the pain area. Our first thing is, let us try to improve our system. There are tools which are there for the systems. In 1 or 2 years, you will be able to improve your system, cut down your cost, and make a smart system for pain management. Then in next 2 to 3 years, you will be able to find out a better regulatory mechanism and be compliant to it, and then start implementing it. First implement it down below, either at the triage level or at the level of where you are trying to use it for choosing which therapy. It is not a clinical decision support system. It is a guidance type of approach which AI will provide you when you are able to feed the right data. And you should only use, if you are not able to use, maintain a good personal EHR. There are two electronic health record and personal health record. So I am talking of personal health record. If you are trying to use personal health record and then apply the various type of tool, and it will be a suggestive, a guidance type of thing, and you will apply your wisdom to reach to the final conclusion. Now, as far as the legal repercussions are concerned, they are all there. To be overcautious, to be undercautious are both harmful. To be intelligent enough to use it rightly, AI can be good, AI can be bad, both. That's all I want to say. So thank you very much giving me this opportunity to talk to you. I stop here.
ठीक है, thank you sir. Good night everyone. Thank you boss.
Thank you very much. Thank you.
Thank you.
Thank you. Bye.
Thank you.